Hi, my name is Mason Dukacek, and today I'm with Nicole Forsberg, who is the owner of a functional medicine clinic in Tulsa, Oklahoma, known as Stem Cell Therapy RX. And one of the things I'd like to talk about today is BHRT, which is bioidentical hormone replacement therapy. And this is all new to me. So would you mind taking a minute to tell people when someone comes to you, what kind of symptoms or difficulties are they expressing that they have that leads you to think like, hey, you know what, this might be a good candidate for BHRT? First of all, what is BHRT? And two, what are the types of symptoms and things that people would come to you to get fixed using this therapy?
So BHRT is bioidentical hormone replacement therapy.
Okay.
And it is a therapy, hormones, which does include progesterone, estradiol, and testosterone. For the males, I typically only include testosterone with them. For females, you can include the progesterone, estradiol, along with the testosterone. So BHRT, it's bioidentical, which it's more closely mimics your own hormones that our body is unfortunately not producing at the accurate level. And that is why we're having the symptoms that when they come into the office, patients, a female will say, lacking a little bit of energy, decreased cognition, possibly a little bit of brain fog, decrease in lean muscle mass, just stamina's decrease, low libido, and then that is more the testosterone for females deficiency.
Okay.
And then along with the estradiol deficiency, you will see other irritability, midsection weight gain, along with possibly vaginal dryness and irritability as well too.
What about guys? If a guy is a candidate for BHRT, what types of things do they come and talk to you about?
So it varies from individual, but a lot of the men will say, Nicole, it's not about libido. My sex drive is okay. It's more about the stamina. When I come home from working my 8-hour shift, I hit the couch and I am ready for bed after dinner. I have no drive in going to my son's baseball game or soccer game, or I'm just exhausted. So a lot of patients will also say, men will say, decrease in lean muscle mass as well too. And once again, decrease in cognition. And I've also had patients, many of them, say a lot of joint pain as well too when their testosterone levels are low.
So what type of testing do you do ahead of time to find out if they need this or to what degree they need it? If they need it at all, and if so, to what degree? What type of testing do you do?
So there's other disease processes that can overlap that, and so I want to rule those out as well too. I get a general panel, CBC, chem panel, along with, for the male, I'd like to see the prostate-specific antigen along with a total testosterone and an estradiol level, and a few others that I incorporate into that panel as well too. Females, very similar, but I also want to rule out any type of thyroid along with adrenal problems, and I go ahead and incorporate an elaborate hormone panel as well too.
So if I understand correctly though, you basically, when you get the results of these tests, you not only know that they need it, but in the exact amounts they need it.
Correct.
So talk to me about the different types of I know that there's like creams and there's injectables. Can you talk about the differences? And well, let's start. What are the differences?
Sure. There's different ways of obtaining these hormones. One is via injection. I do not recommend females having testosterone injections. It's a very fine area for injecting testosterone for females, but for males, it's a great way to start if that's what they choose. I think creams for a lot of the males are difficult. You have to apply them once to twice daily. It can just be a nuisance, but also along with the patient just doesn't absorb it as accurately as I would like the patient to. But so if they choose to go testosterone injections, then that unfortunately is a synthetic form of, so it's not as identical to our body processes as the pellet form of testosterone that I choose to use. So that would be a small area on the hip. I inject, place the pellets there. They last anywhere from 5 to 7 months for most men.
Okay.
So it's twice a year typically for males. Females, very, very similar process. Some patients do very well with creams, which I do recommend, and they're bioidentical. And then if they choose that that's where they'd like to be and they don't want to apply creams anymore, then I would recommend the pellets. Same technique. Patients for testosterone for bioidentical hormone replacement for females typically lasts anywhere from 3 to 4 months.
Okay.
And patients do quite well.
With so if let me feed this back to make sure I understand correctly. So what you're telling me is the creams obviously requires more maintenance. It's like every once or twice a day they have to apply
Correct.
the cream consistently. Where if you get the pellets, then it's like one and done for if you're female, like 3 to 4 months, and if you're male, you said 5 to 7.
Correct.
Okay, so really it's really much preferred by the patient.
Correct. Hormones trump just about everything in the human body except for the beating heart. But they really do. They really have such a draw and such a pull on how we live our lives. So if you're having any of those symptoms, I highly suggest that you get evaluated and have some labs done to find out exactly where you're deficient.
Cool. Thanks.